Next exam question now. For the next exam question is all around neonatal sepsis. Okay, so here you're asked to discuss neonatal sepsis, but not general. It's under some particular what do they call it? It's under some particular headings. Okay, so they said define neonatal sepsis. List 6 factors, okay, that will possibly cause neonatal sepsis. Discuss investigations that can be done in a 2-day-old that has neonatal sepsis. Talk about the prevention of neonatal sepsis. So 4 questions in one. We'll hit it one by one. Now, for definition, you should know that neonatal sepsis is a clinical syndrome in a newborn that is at least up to 28 days. That is at least less than 28 days or equal to 28 days old. So it's characterized by systemic infections, bacterial infections, viral infections, fungal infections. Okay, so there's a whole lot of signs. Okay, so they didn't ask you to talk about the symptoms, so you can just fuse the symptoms into what the definition, okay, to help you. So you talk about the signs of fever, lethargy, poor feeding, respiratory distress, circulatory compromise. So we have different types of sepsis: early onset sepsis, late onset sepsis. So early onset sepsis is just simple. Within the first 72 hours of life, that's 3 days. Late onset, anything above that 3 days up to 28 days. So once a baby past 28 days, is no longer a newborn. So what are the 6 risk factors for neonatal sepsis? Like, what could possibly make it that this neonatal sepsis actually came in? So prolonged rupture of membranes. So the mother had ruptured of membranes, but it was actually left for too long. Maternal fever or chorioamnionitis. So probably the mother had some underlying infections. So prematurity and low birth rate. The baby was born before their due date. So this makes them weak automatically. So invasive procedures, probably, they went into the reproductive system repeatedly and all of that. So that kind of like what pushed infections up. Then poor hygienic delivery practices. That means the place and the people involved in delivering that baby wearing neat. Okay. Then maternal urinary tract infections, or the mother had some sexually transmitted infections. So what's the investigations you do for a 2-day-old that has what? Sepsis? Of course, this is early onset sepsis. So complete blood count. You're actually trying to look out for what? Levels of white blood cells and levels of platelets. C-reactive proteins. You're also trying to see if what inflammations is going on. Then peripheral blood smears, okay, urine cultures. When it is late onset sepsis, you can actually track the microorganism causing the issue right there in the urine. Okay, lumbar puncture, chest x-rays, if the baby is having all those respiratory distress. Then blood glucose and electrolytes. So how can you prevent neonatal sepsis? So antenatal care, you are screening the mother since way back. Clean delivery practices, early and exclusive breastfeeding. So hand hygiene and infection control. Then if they will do any invasive procedure, at least it should be worth it and it should be done properly, like insertion of catheters, IV lines and all of that. Then immunize the mother and the baby. Okay, very, very important. Immunization, very important.